Hi, everyone. I'm Erin Kaleba. I'm with the Office of Research's Data Office for Clinical and Translational Research. I'm with my colleague, Drew Bennett, who's from Innovation Partnerships. And this is a topic that's gotten a lot of attention, but I think you could probably bring it up every 6 months and there would be something new about it. And so just knowing what this group does and the types of data that we are helping researchers harness. We thought it'd be good to talk about what are we required to share, what should we know about that, and we'll base our comments on the NIH data management and sharing policy that came out January 25th, 2023. Not that I have a life, but I do know the date. But this is true of a lot of federal funding agencies. This NIH is certainly the biggest funder for Michigan research and health research, but it's not the only one. NSF and other funding agencies have had policies like this for a long time. This is very new to the healthcare space. And so that's, I think, why it's gotten so much attention from our faculty and our departments. A word that doesn't come up much when you first see that is responsible management and sharing. So open science in general is something that the principle itself is something we could all agree to, that if my taxpayer dollars are going to fund the government and the government is going to fund research, then the research has to benefit everyone. And that means not just those who were in the study or at the institution where it was carried out, but everyone should benefit from research. I would say, regardless of the funder, but especially if the funder is a government agency. And so how do you make your research results available to others in responsible ways so they can be reproducible, so they can be translated, so they can be tweaked and adapted by other institutions? And so that was the impetus behind what the NIH data sharing policy is. And we'll talk about both sharing data and sharing code. And sharing code really gets into some of the IP, the intellectual property issues, and that's where Drew will share what he's learned. The Research Data Stewardship Initiative was that came out of Rebecca Cunningham in the OBPR in response to the upcoming NIH policy. So back in 2022, a group of us started to get together and talk about when this policy would go into effect. And the policy meant that any proposal submitted after January 25th of 23 had to have a data management plan included in it. That was it for now. This was always a requirement if the total award amount was over $500,000, but now it's a NIH research grant of any amount. You need a data management plan included. So the Research Data Steward Initiative have had 4 main goals. It's ongoing. It has 4 main goals, starting in the top left: coordination, hopefully centralizing some of the activities around responding to the new requirements so that each department or school isn't trying to come up with it themselves. Also providing trainings, a shared understanding of what needs to be made available after your project. Kind of a central place to go for guidance on this topic in general. Outreach, we had countless meetings with faculty and departments and focus groups, and Drew and I were even on a subcommittee looking at publications. And you publish a manuscript in a journal, and the journal says you need to make the data available that went into the findings. If we're going to publish your paper, we need the data behind it. What does that mean? So tons of work in this area. And then probably the biggest thing that will live on, I hope, out of the RDSI is a policy. So there's actually a SPG 303.06. So if you haven't read it, that's what, and it just says, here's how the university is interpreting and putting into policy that NIH guidance. So the NIH guidance says things like, you should keep your data for 3 years after your study's finished. Our SPG says 7 years. So it's just how we locally will interpret the NIH guidance. So the management plan that goes into your proposal has things like, what kind of data are you collecting? Is it survey? Is it electronic record? Is it from a wearable? What tools and software are you using to do it?
again, think about all this so that the results can be reproducible. You would say we use this Fitbit, this particular software was used. You say we mapped the data to these standards. Maybe we used Fire standard to transmit the data. You're kind of putting together a whole cookbook of what you plan to do with the data, and your data management plan as your study starts can. What are your timelines for collecting? What's your plan for distribution or reuse? Who is the oversight group at your institution who's going to make sure you're adhering to your plan? So this is all up to 2 pages of your proposal. So here's some frequently asked questions, which I think it's a better way to get at what is this really? So first thing we heard from researchers was, am I expected to share all the data that I generated from my research? And the answer is no. It's expected that you'll share scientific findings. So if you again think of a manuscript, what went into the table? What went into the chart? What are the data that really are your results or your findings? That's what's expected to be shared. Not all scientific data might be appropriate to share. So let's go into exceptions. When do you not have to share data that was funded by NIH? And basically, it's when there are regulatory or compliance laws or appropriateness where you can justifiably say, this is not okay to share. These data are too sensitive, or there's only 10 people in my study, they'll be identified. And so small sample sizes do not need to be shared to protect individuals or scenarios. I don't know what this means. It's NIH guidance data that researchers anticipate won't be widely used. I don't know what that means. But at the end of the day, HIPAA, federal regulations, and your own institution's rules carry the day above the NIH policy. And so let me give you an example. I had a researcher ask if I could speak with a publisher because they had a paper they wanted to get published that was on GWAS, or genotype findings. And the publisher said, send me all your genotyped data. And the lead author from Michigan said, no, we consider that PHI, even though it's not, genetic data is not yet deemed, protected health information. And so I said to them, this is a time when our institution's rule is going to weigh above your publication and the NIH. And, the investigator was like, please don't hinder my chance of getting published because I need this, which I agree. But the manuscript, the journal totally understood and said, then give me a data availability statement, and anyone interested in reproducing your findings will just reach out to you, sign a data use agreement, and they can have the data. They were totally fine with it. But that's a time when our rules were stricter than NIH, and I just helped facilitate that at the time. And then when do they have to be shared? Because you really want to protect the investigator's ability to do the first publication, submit another proposal, and that's kind of how a lot of people make tenure. That's your IP, that's your baby that got you into where you are professionally. And so there are ways to embargo your findings sometimes, but basically the NIH says at the end of the grant, the close of your grant, or at the time of your publication, your findings, your research findings from that funded work should be in a repository. And there's a list, there's lots of resources available from the NIH and from U of M. And Victoria, I'll send you these slides, but they're all hyperlinks here that are really good. There's sample data management statements that you can use. There's sample plans that you can put into that you can share with your researchers, and you can put into your proposals going in. Just a lot of boilerplate language, so no one has to come up with it on their own. But I think we're going to learn as we go here. Last fall, the first grants that had the required data management plan in them were funded. So we still don't really even know how this is going to play out. But one of the things that is really helpful to point researchers to is the list of approved repositories and what makes that repository ideal or not ideal for the type of data your researcher has. So here at Michigan, there's a great repository called Deep Blue Data, and anyone's depositing their data in there has a chance to index it, so you can say how it was collected, on whom, during what time period, what were the the conditions under which the data were collected, so someone can know if they want to reuse it or not. Deep Blue is not okay for any data containing HIPAA identifiers. So it's not okay for even a limited data set that would have dates of service in there. And so there's a lot of resources on our U of M page about what type of data do you have, how identifiable is it, here's a repository that you should consider.